I'm Josh Arthur. I am the Director of Managed Care Analytics. I've been with Community Health Network for approximately 15 years, and I'm a former Boys and Girls Club member. It developed me into the professional I am today. Ethics, morals, sense of loyalty. It was a safe place to go when there was nowhere else to go. It kept me off the streets. I don't think I would have been here today if it wasn't for that.
I've been working here since 2007. And as soon as I came from Texas, got my children here and have Jose, got him enrolled. They transformed him to a young man. Like, he does a lot of things here and he's very good at school. And I said, if they did this to my son, how about my other son? I got my whole family here, basically.
I've been very blessed in my life in the fact that I went from one organization in the Boys and Girls Club to another, which is Community Health Network. And I completely feel like we do similar work. We help those who are really in need of it, not only contributing to the physical health, but the mental and social health of the youth there.
We help the parents. When we see the need, saying, hey, you know what, we don't got uniforms. We try to get, uniforms from the kids that they don't fit anymore. We bring them in here. Hey, these fit you. We try to do as anything we can for our children because if you think about it, this is our future here. If we don't take care of them, who will? Sometimes it's like when we tell the children, hey, you're doing okay. Probably that's the only hug they're going to have that day. Probably this is the only meal they're going to have this day.
There's a fundamental need for food resources, It's just really hard to go back to those days when you don't have food. And even though I've benefited from the many things that the Boys and Girls Clubs have done for me, I still lose sight of it myself. And it's hard to remember those difficult times, but they're there.